Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It's very different than pediatric scoliosis. In adults, it's often painful, it's stiff, therefore it's not responsive to bracing like you have in adolescence, and it often causes both back and leg pain, whereas adolescent scoliosis is not often painful at all. Why does it occur? Well, adult scoliosis occurs for two reasons. One is exacerbation of scoliosis from when a person was younger. If you get skeletally mature and your curve is at over 40 degrees at that point, then usually it will exacerbate at a rate of 1 degree per year. That might not sound like a lot, but let's say you're 17 when you get skeletally mature, then you go another 50 years. That's 50 degrees plus 40. That means you may have a 90-degree curve. So it adds up. The other reason it may occur is due to simply new spinal degeneration. You may have nothing as a kid, and then as you get older have disc degeneration that then causes abnormal movement in the facet joints in the back, and that can lead to asymmetric arthritis. Nerves can get pinched as well, and this can lead to the leg pain. So the symptoms include back pain from the facet degeneration, and you can also have muscle weakness and aching because it may be tough for you to stand up straight, so you're constantly working your muscles to do that. And then the spinal stenosis can cause leg pain. You can see here, this is called the concave side of the curve. Okay, these nerve roots are trying to get out in these areas so they can get pinched. The treatments for adult scoliosis include over-the-counter medications like Tylenol, anti-inflammatory medications, and then a person may need prescription medications such as high-dose, high-strength non-steroidal anti-inflammatories, neuropathic medications such as Neurontin, narcotics for short-term pain relief, topical pain medications. Physical therapy can be very helpful along with interventional treatments. The interventional treatments that tend to help can include facet joint injections. You can see one here going right into a facet joint. Let's say this is an arthritic joint. It can help if steroid goes in just like it can for knee arthritis or hip arthritis in those joints. The steroid may stick around and provide pain relief for weeks to months. Trigger point injections, which are subcutaneous injections, can help with muscle spasms as well. A medial branch block, which you can see here, provides numbing medicine and steroid around a joint, which is where these little nerve endings called medial branches supply sensation to arthritic joints. That can provide pain relief for a few weeks to a few months in and of itself. Okay, if that works and then wears off, then a radiofrequency ablation procedure can be administered, which involves heating up these little nerve endings around these arthritic joints and deadening them, and that can provide pain relief for anywhere from 6 months to 2 years. Amazing. Now, if a person has spinal stenosis from the nerves getting pinched, then epidural injections can work extremely well for those. Outcomes with non-operative treatment: over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Between the treatments for back and leg pain, most patients do not end up needing to undergo an operation. Remember, surgery is elective, it's a quality of life procedure, and it should be a last resort because there really is a high complication rate with these procedures. You may need to have a long fusion, such as you see here, to get proper correction. Maybe here down to here, but it's a lot of levels to fuse, and the complication rates are well over 50%. Adults simply do not tolerate these surgeries like kids do. The top non-operative pain management in the state of Washington is through the Washington Pain Network. Over 50 insurances are accepted, and over 25 treatment options are provided, with success rates that average over 90%. The pain management doctors are board certified and award-winning. Visit us on the web at washingtonpainnetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.